Hi, today's topic is rabies. Rabies, it's a deadly viral infection that spreads to people from the saliva of infected animals. See, it will spread from the saliva of the infected animal. How, though, which are those infected animals? Infected animals are like stray dogs, cats, and bats. When stray dogs or cats or bats bite to you, it will cause rabies. Next is cause. How it will cause? It's a RNA type of disease. So RNA virus called Lisa virus will spread the rabies. Okay. Next one is mode of transmission. That means how it will transmit to a person. See, stray rabies is found in the infected animals. Infected animals like dogs, cats, cow or horse. See, these will be infected. These will carry in the saliva. So these infected animals will carry in their saliva that rabies virus. When these animal bite to a person or a man or woman or a person, it will bite, it will spread from the saliva. Next is signs and symptoms. What are the signs and symptoms for rabies? See, initial symptoms during when they bite within 2-3 days, it will cause headache, fever, tingling in the site of bite, fatigue. Later on stage, it will be a hydrophobia. That means there will be a fear of water, light sensitivity. When they see the light, they will make fearful reactions. Then excessive salivation, like dog, how the dog will behave, the affected rabies dog will behave, like that only person will behave. Then aggression will be there, insomnia, loss of sleep, and hallucinations will be there. Next one is diagnosis. What are those diagnoses if the person is having rabies? Means first to the foremost is, if you are bitten by any dogs, you have to remember those things. Then first they will test the animal through intracranial. They will take an intracranial of the dog, they will take the sample and they will test whether the dog is having rabies or not. Then for us, they will do lumbar puncture, skin biopsy, blood tests, head MRI and CT scan. Why? Because means the rabies virus, once it bite, from the bite side it will directly connect to the spinal cord. So they will do head MRI and CT scan. Next one is treatment. See, after coming after once you affected by the rabies virus, there will be a vaccine, and that means pre-exposure prophylaxis is there. Those are rabies vaccine. It was invented by Louis Pasteur in the year of 1885. It's a intradermal or intramuscular injection. They will give in the hospitals, any government facilities. Now they are issuing free of vaccine, so please take the vaccine. Now, categories of dog bite. This means when you have to take vaccine. See, there will be a stages of biting of dog. So category 1, licking or touching on intact skin. See, dogs and cats will do this. So during that time, you no need of taking what is that vaccine, but still we are believing that this also will cause you rabies. So if your dog is not vaccinated, then go and take your vaccines. Okay. Then saliva on scratches or abrasion on skin without bleeding or nibbling of uncovered skin. See, there will be a scratch in your skin, the dog will bite or lick over there, you have to take the vaccine. Okay. Next one is category 3, bite or scratches that penetrate the skin. When dog bite your wound deeply, that time you have to take the vaccine. Vaccine schedule. See how they will give. Now this is not like only one dose they will give, not like that. It is like intramuscular. I told you before, that is intramuscular and intradermal. In intramuscular they will give 5 doses. In intradermal they will give only 4 doses. Okay. So intramuscular 0 day, that means when the dog bite, then 3rd day, 7th day, 14th day and 28th day. But in intradermal, 0 day, 3rd day, 7th day, later on 28th day. But during these time you have to observe for the dog. If dog dead or anything, you have to report those things to the doctor. Next, how we can prevent the dog bite, because nowadays it's a very common things to death. So we are having in India we have a plan to 2030 we will eliminate the dog bite, rabid dog bite. Now we are planning to eliminate by the end of 2030. So for that, everybody should aware of this rabies and how vaccines and prevention. Okay, first, rabies guidelines. If you are bitten or scratched by an animal, if an animal bite or scratch to you, then what you have to do? First, you have to wash the wound with a soap and water. Please thoroughly wash the wound. First, you have to wash the wound, then contact your healthcare provider as soon as possible. If Please don't delay the treatment. You may need to get a vaccine to prevent rabies post exposure prophylaxis. You have to take the vaccine. You are like, no, our dog is already vaccinated, but also you have to take back because there will be a chances of failure of vaccines. So please take the vaccine once you got bitten by the dog and as soon as possible. See how to avoid rabies. Avoid these animals: cat, dog, bat, mice. These animals you have to avoid. Rabies prevention. How to prevent the rabies? Make sure your pets vaccinated are up to date. Please make sure, if you are a pet lovers, please make sure your pet is getting vaccinated up to date. Don't let your pets roam free without supervision. See, one sometimes your pets have taken the vaccine, but in stray dogs, those dogs if bite to them, they will get the rabies. So please have a supervision. Then leave wildlife alone. Don't touch injured animals. See, wildlife, don't touch the injured animals or anything because they will bite you. Bats are the most common source of rabies in US. If you have find a bat where you are sleeping, assume you have been bitten. See, if you are, don't live in the place of bats, or if you are living those place have bats, please avoid the place. If you are at high risk for rabies, ask your provider about pre-exposure prophylaxis. See, we will like forest department and animal husbandry or veterinary department. Those people have to take the pre-exposure prophylaxis because they will be always handling with the animals. So there will be a chance of more biting of dogs, dog biting by the dogs. So they have to take the pre-exposure prophylaxis. If you have been attacked by an aggressive wild animal, call animal control. See, if you have found any dogs, so they will have been having aggression, or we will call in Kannada like huchnai. If you find that, please call to animal control department. Okay. So these are all about what is rabies, how it causes, what are those symptoms, and what vaccines they will give to rabies, and how to prevent. So please, whatever it may be, if you get lick or just small scratch by dogs or cats or bats or any other animal, so please contact the nearby healthcare and take the vaccine. Vaccine is free and it is safe. So thank you. This is all about rabies. Thank you so much.